Mental Health Treatment for People Experiencing Homelessness in California by Suzanne Papaconstantina. All right, there's a community need for this population. Mental health counselors can be on a multidisciplinary team and can play a key role in developing treatment program using a person-centered approach. There are some co-occurring factors that can complicate mental health treatment for this population. Depression co-occurs with this population. They have minimal support, adverse childhood experiences, trauma, lack of family residence in the state. Some of the systemic factors, such as unstable housing, unstable employment, budget limitations, California's high rate of homelessness, impoverished conditions, lack of funding, insufficient documentation, lack of wage labor and affordable housing makes a crisis. So some of the statistics in January 2020, before the pandemic, on one night, they found over 161,000 homeless people in California. For people who are homeless and unsheltered, 51% of those people in the country live in California. Texas is the next highest state that has people who are both homeless and unsheltered, but California has 9 times more of this population than Texas. And the weather gets hot in downtown LA, low of 42, high of 111, much more extreme in other parts of the state. So treating the mental health of people living in these conditions is the goal of this project, using a person-centered approach to help them gain strength, get in touch with their personal capacities, their values, their growth goals, positive self-regard and autonomy. This project uses elements of crisis counseling and psychoeducation using DBT skills. The environmental context is an important dimension that informs this treatment. The framework of ecological theory to look at the reciprocal influence of different environmental contexts and how they affect the development of people can inform treatment. And the two-dimensional model of mental health that includes looking at individuals' mental health and mental illness is another framework. And some of the established models, the Backpack Medicine Center model uses a COVID response team that has a mobile patient-centered medical home that delivers treatment. It's an integrated care model and a multidisciplinary team on that care model would include medical personnel, drug and alcohol personnel, social services, law enforcement. The counselor's role includes assessments geared towards homelessness. So a couple of assessment tools I found were a homelessness-based questionnaire to inquire about the presence of children, partnership status, pregnancy, domestic violence, proximity to relatives, material support, their housing situation, their alcohol and drug use, and their overall health. And assessing their support system types is important. Where do they get their emotional support, their service support, instrumental support? And the categories of supporters, it could be from agencies, could be from people in the street, people from home, from family. All right, so one way to measure success, this project, is if people who are treated express gratitude, especially for Spanish-speaking team members. California has a high demand for Spanish-speaking staff. A summative survey can be administered after each treatment just to determine whether individuals felt strengthened by the support, and self-reports can determine if people felt improvement in their personal situation. Thank you very much for letting me give my project. Thanks.